So starting with today's lecture, in today's lecture we are going to discuss the topic number 16 from Kant's philosophy, that is oversensitive patient. So what Dr. Kant explained about the oversensitive patient in lecture number 16 in Kant's philosophy. So in this he first give the reference of aphorism number 44. So you know what is given in aphorism number 44. Aphorism number 44, it is related to the what happens when two similar diseases meet together. And in aphorism number 44, Dr. Hahnemann explained about that is two similar diseases can neither, as is asserted of dissimilar diseases in, repel one another, nor, as has been shown, of dissimilar disease in, and suspend one another, so that the old one shall return after the new one has run its course. And just as little can two similar diseases, as has been demonstrated in respecting dissimilar affections, exist beside each other in the same organism, or together form a double complex disease. So in this aphorism, that is aphorism number 44, Dr. Hahnemann explained about that is when two similar diseases meet together in body, they neither repel nor suspend nor form the complex disease, which is formed by the dissimilar diseases when meet together in body. But when similar diseases meet together in body, they neither repel, suspend, nor form the complex disease in the body and makes cure in the body. That is when two similar diseases in body. So why Dr. Hahnemann give why Dr. Kent give the reference of this aphorism in this chapter? That is, it is related to the oversensitive patients, the patients who are very sensitive to each and everything, or the to the homeopathic medicines. These we call it as a oversensitive patients. And in these patients, how cure occur or how to treat these patients, Dr. Kent explained about this in this chapter. So for this reason he give the reference of aphorism number 44, in which we can say that that is when two similar diseases meet together in body, they neither repel nor suspend nor form the complex disease. But what is the case in oversensitive patient, that is explained by Dr. Kent. So in this, with the reference of this aphorism, we will start with the topic, that is oversensitive patients. So in oversensitive patient, Dr. Kent explained about that is drug poisoning, such as we referred to in last lecture, is not always due to the prescribing of a crude drugs. That is, up till now we know that that is when we give the medicine or when we prescribe the drug in crude form, that causes the drug poisoning. This is the theme, that is drug poisoning such as referred to in last lecture is not always due to the prescribing of crude drugs. If we work long among sensitive patients, you will see come across those who have been actually poisoned by the inappropriate administration of potentized medicine. That is, it is not the case that is if you prescribe the crude form of drugs, that always causes the drug poisoning, but it is the case when you work along with the sensitive patients. In sensitive patient, it is they can be poisoned with an inappropriate administration of potentized medicine. That is, when you give the potentized medicine in inappropriate form, this also causes the poisoning in that sensitive patient. So only giving crude form of drugs that causes the poisoning, it is not the case. In inappropriate administration of potentized medicine can also cause the poisoning in the patient. So these are the oversensitive patients who have received repeated doses of medicine after the medicine and the dose that was homeopathic to their condition was administered. So in that case, that type of patient which causes the drug poisoning after the potentized form of medicine also, and when that oversensitive patients received the repeated doses of medicine after the medicine and the dose was homeopathic to their condition was administered. So this type of patient we call it as a oversensitive patient, that if they even get the medicine in potentized form, they causes the oversensitiveness or the drug proving to that particular drug. So if a drug that is really homeopathic to the case is continued after enough has been given to cure, a miasm is established in some cases by that drug, and this miasm imitates one of the chronic diseases and one of the acute miasm in accordance with its ability. I have a patient who have been suffering from 7 to 8 years from the effect of lachesis. I have a patient who are suffering from sulfur and other deep acting medicine which have been repeated too often when truly indicated, or repeated in sensitive patients when not truly indicated. That is, when you give the medicine to the sensitive patient, in that sensitive patient, the doctor can't having some examples regarding, that is, he having a patient who is suffering from the bad effects of a lachesis, that is the effects of lachesis from 7 to 8 years, that is that patient having the lachesis for many days and in repeated doses. So you have to indicate that medicine, that is the deep acting medicine, you have to give the medicine in appropriate way or in a uh, guideline that is given by Dr. Hahnemann, and not in a repeated form. If you give the medicine in repeated form, that is the deep acting medicine, that will cause the patient to suffer for a long time, that is without the disease the patient is suffering from the effect of that medicine. So in that cases you have to be cautious while indicating the deep acting medicine, or when you have to repeat that medicines. So the indicated or the repeated in sensitive patients when not truly indicated. If the medicine is indicated, then you have to give it, and not unnecessarily you have to repeat the medicine in sensitive patients. The symptoms of a drug crop out periodically years after it has been abused and periodically attack are perfectly typical of the drug. The mineral substances which are perfectly harmless on the crude plane may be poisonous on the dynamic plane when the patient is oversensitive. That is, you have a mineral substances, that is the medicines prepared from a mineral substances which are harmless in a, that is these mineral substances are harmless on the crude plane but by poisonous, but become the poisonous by the dynamic plane. That is, you know that the silica is inert or non-reactive in crude form, but when we prepare the medicine from silica, that is the silicia, when you give the medicine to the patient, it may causes the serious effects in the patients. So the medicine or mineral substances which are inert in a crude form may be poisonous in a dynamic plane. And when the patient is oversensitive, that is, if the patient is oversensitive, in crude form the medicine may not affect it, but in dynamic form it causes a severe effect. There are persons who can drink a glass of milk with impunity and be nourished by it, but upon whom a drop of milk potentized to a high degree and repeated beyond its homeopathicity will establish a miasm that will last for years. That is the person, that is that if you consider the two persons, one person getting a glass of milk and he become a nourished, but upon whom a drop of milk, that is a potentized to a high degree repeated beyond its homeopathicity will establish a miasm. That is, when you give take a one drop of milk and that is potentized, and if you give that potentized drop of milk in repeated doses to that one person, that may establish a miasm in that person and that may last for years. So in this para, what Dr. Kent wants to explain, याच्यामध्ये त्यांनी काय सांगितले की फक्त क्रूड फॉर्म मध्ये जर मेडिसिन घेतलं तरच ड्रग पॉयझनिंग होतं अशातला भाग नाहीये. तुम्ही जर पोटेंटाइज फॉर्म मध्ये जर मेडिसिन घेतलं आणि ते रिपीटेडली जर घेतलं किंवा ते जर तुम्ही पेशंटला देत आहात आणि जो जर पेशंट ओव्हर सेन्सिटिव्ह आहे तर तो काय करतो, सिव्हिअर इफेक्ट दाखवतो. त्या फॉर्म मध्ये सुद्धा, डायनॅमिक फॉर्म मध्ये सुद्धा तो काय दाखवतो, सिव्हिअर इफेक्ट दाखवतो. का? कारण की तो पेशंट काय आहे, ओव्हर सेन्सिटिव्ह पेशंट आहे. याच्यामध्ये त्यांनी आता काय एक्झाम्पल दिलं, दॅट इज द मिनरल सबस्टन्स. जे काय मिनरल सबस्टन्स पासून आपण मेडिसिन तयार करतो ते क्रूड फॉर्म मध्ये कसे असतात, इनर्ट असतात, काहीच रिॲक्शन दाखवत नाहीत. पण जर आपण पोटेंटाइज्ड फॉर्म मध्ये ते मेडिसिन जर ओव्हर सेन्सिटिव्ह पेशंट मध्ये जर वापरले तर ते काय करतात, सिव्हिअर रिॲक्शन दाखवतात किंवा त्याचे बॅड इफेक्ट दाखवतात. त्यासोबतच आता काय सांगितलं त्यांनी की एक पर्सन आहे त्याला आपण पूर्ण ग्लासभर जरी मिल्क दिलं तर तो काय, हे क्रूड फॉर्म मध्ये झालं. मिल्क, डायरेक्ट मिल्क जे आपण घेतो ते क्रूड फॉर्म मध्ये मिल्क आहे आणि ते घेतल्याच्या नंतर त्याला काय फक्त नरिशमेंट मिळते. पण त्या मिल्क मधला आपण एक ड्रॉप जरी मिल्क घेतला आणि तो पोटेंटाइज फॉर्म मध्ये जर यूज केला इन रिपीटेड पोटेन्सी विदाउट द होमिओपॅथिसिटी, म्हणजे होमिओपॅथीचे रूल न पाळता तुम्ही रिपीटेड जर तो ड्रॉप ऑफ मिल्क इन पोटेंटाइज फॉर्म मध्ये जर त्याचं मेडिसिन जर रिपीटेडली जर घेतलं तर तो काय करतो की त्या पर्सन मध्ये एक मायाझम निर्माण करतो. आणि मायाझम निर्माण करतो म्हणजे एक डिसीज कंडिशन निर्माण करतो. आणि ती डिसीज कंडिशन कशी राहते की रिमेन्स फॉर अ मेनी इयर्स, लास्ट फॉर अ मेनी इयर्स. सो दिस इज रिगार्डिंग, that is the medicine which is in crude form always not causes the drug poisoning, but the medicine which is used in a potentized form in repeated doses in a oversensitive patient, that may affect that patient severely. Then, are you able to understand? Yes. नंतर काय सांगितले त्यांनी याच्यामध्ये, approver of lac can had a return of its symptoms periodically. She was an oversensitive and proved the medicine indiscriminately and has suffered ever since from its poisonous effects. Whereas if it had been given prudently, the disease would be established itself upon the body like any acute miasm and have run its course and disappeared. It is unwise to make proving upon oversensitive subjects in that way. I tested a very high potency of lachesis on an oversensitive patient, giving but a single dose, and that patient ran the course of the lachesis disease is about 2 months. The symptoms disappeared and never returned, while the lachesis was in progress. The patient's chronic symptoms were suppressed, but after it run its course and disappeared, her chronic symptoms come back. This is in accordance with the doctrines. She was oversensitive, and while the dissimilar lachesis disease was in full blast, her chronic disease was suppressed. But these are instances when such a patient is truly homeopathic to a remedy, and if that remedy be repeated after enough, I mean in internal sense, has been given to cure, it ceases its homeopathic relation and acting through the general susceptibility creates a miasm upon this extremely sensitive patient. When a patient is hypersensitive, you must avoid the use of the CM and the other very high potencies, which will make your patient sick, and use instead the 30 and the 200 potency. In cases where the remedy is indicated, such potencies will work quite quickly. So in this para, Dr. Kate explained about, that is when you are using the medicine in potentized form in oversensitive patient. That is important. That is, when you use the medicine in potentized form on an oversensitive patient, you have to give the single dose of medicine and not the medicine in repeated form. As you give the medicine in repeated form, it will make a particular chronic condition in that patient, and that patient may suffer for a long year. But when you use the single dose of medicine, that will affects the patient and that may cure the patient. So in this he give the example of lachesis, that is he give only one dose of lachesis and the effect of lachesis was about 2 months. He shows the effects of lachesis for 2 months and the symptoms disappeared and never returned. While the lachesis was in progress, the patient's chronic symptoms were suppressed, but after it run its course and disappear, her chronic symptoms come back. That is, the patient is oversensitive and you prescribe the lachesis. So the symptoms uh, that is disappeared and never return, that is of lachesis. But the what is the chronic symptoms which are present in a patient that are suppressed due to that effect of lachesis, and when the effect of lachesis is gone, in that case the chronic condition which is suppressed, it is come back. So in that cases the two dissimilar diseases meet together in body. That is the disease condition which is already chronic condition present in a patient, that is one, and the second which is produced after taking of lachesis. As this is not the similar medicine to that patient, that causes the dissimilar diseases meet together in body. And when two dissimilar diseases meet together in body, you know that they either repel one another, they suspend one another, or they form the complex disease. So in that case, what happens? The newly formed disease, that is due to the lachesis, it causes to suspend the weak old disease, that is the chronic disease which is present in a patient. And after the course of that lachesis, the old disease reappears, that is the chronic symptoms reappears in that lachesis, sorry, in that oversensitive patient. So she was oversensitive, and while the dissimilar lachesis disease was in full blast, her chronic disease was suppressed. These are the instances when such a patient is truly homeopathic to a remedy, and if the remedy be repeated after enough has been given to cure, it ceases its homeopathic relation and acting through the general susceptibility creates a miasm this extremely sensitive patient. So in that cases, when you use the medicine in dynamic form in repeated doses in sensitive patient or in oversensitive patient, that will make the miasm or that may produce a disease condition which may last for many years. So this is regarding the that is explained by Dr. Kent in this two para. Then in the next paragraph, Dr. Kent give the reference of aphorism number 46. So what is given in aphorism number 46? So in this there are the different examples, that is when two similar diseases meet together in body. That is Hahnemann in aphorism number 46 gives examples of these natural cures, that is how natural cures takes place. These examples are explained by Dr. Hahnemann in aphorism number 46. So what Dr. Kent explained about it, we occasionally meet with these cures now. That is how the natural cures occurs. This is occasionally meet with these cures now. We find patients that are threatened with phthisis go to the south because it has been proved that such cases can go into a vitiated climate and stay for a number of years and actually receive benefit from this disease producing neighborhood and go away well. Other go into a climate more wholesome and they are not cured. The miasm can cure all similar diseases and the curing substances are in attenuated form. The evils that arise from these swaps are similar to the evils of economy of the patient, and that the similitude in antidotal in is curative and causes change back into order in accordance with the external law that governs the action of similars. So in this para, Dr. Kent want to explain that is when two natural diseases, or there are examples regarding the how natural cures occurs. That is the patient having a presence of one disease naturally, and when the other disease affects her, that is in the similar form, that old disease gets cured naturally. So these are the different examples that is given by Dr. Hahnemann in aphorism number 46, and with the reference of this, Dr. Kent want to explain that is these natural cures can occur. In this he give the example of that is phthisis, that is patient having a phthisis, and when he change his atmosphere, he naturally gets cure from that phthisis. That is when he goes in that particular atmosphere, that particular atmosphere affects the body, and that will cures the phthisis. So this is one of the example regarding this Dr. Kent explained. Then there was a time in the early days of homeopathy when, taking into the view the great array of disease forms to be contented with and the very few medicines then at his command, the homeopath was worried to find remedies similar to all his cases. That cannot be true now. If the homeopath will work in a systematic way, he will be able to command enough of the material medica to meet all the diseases that he comes in contact with, the symptoms of which are sufficiently observed. So, in a long time before, when there is not the proving of that much homeopathic medicine is present, at that time the physician was in the confusion of that is finding out the similar medicine for every disease case. But this is not the case now. That is, we have a proving of a number of drugs, and when the homeopathy work in a systematic way, that is when he work in a systematic way, he will command on a materia medica, then he will meet all the diseases that he comes in contact with and the symptoms which are sufficiently observed, that will be matched with the symptoms of the medicine, and you will find a similar medicine to cure the patient. Then in next para, Dr. Kent explain as every man should put himself to the task of studying the materia medica. He has no time to lose, no time to fool away. The physician can really have no excuse at the present day to leave over proved medicine, the medicines that are recorded in our books. He can have no reasonable excuse for stepping aside into ways that are dark, recommended only by tradition. Some physicians hold that it is liberal to do anything for a patient. This is a pitfall, a rock that will destroy any physician that will not avoid it. We know that there are doctors who claim to the homeopaths who attempt to justify upon some ground or other the administration of remedies merely to palliate and relieve suffering. So, in this, Dr. Kent want to explain that when you are a homeopath, you must have a knowledge of materia medica, and for that knowledge of materia medica, you cannot put forth any other thing. That is, you cannot only depend on a repertory, you cannot depend only on a computers or all these things. To cure the patients, you have to make a task of studying the materia medica. That is, the homeopathic physician must have a thorough knowledge of homeopathic materia medica. Then and then only he can practice homeopathy very well. and there is no any excuse for the study of materia medica. So in this, Dr. Kate also explained as, it seems to me that no one who is honest and who has knowledge of stupidity that comes after the administration of a medicine that will cause the symptoms of disappear will actually tie his hands against the finding of a remedy that will be suitable to cure. As surely the voice of the symptoms is hushed, so surely does the physician put out his way the opportunity for selecting a homeopathic remedy. When the index of the remedy is spoiled, the ability of the physician to benefit his patient is destroyed. If you give a quinine, go on with it. If you give an opiate, go on with it. Do not go back into homeopathy. This man who does these things is a homeopathic failure. Some men are some men are incapable of grasping the homeopathic doctrines and fall into mongrel, which is a cross between homeopathy and allopathy. I would refer an allopath to one who professes to a homeopath but does not know enough homeopathy to practice it. So in this para, Dr. Kent want to explain regarding the mongrel sect, that is the crossbreed dog, that is who study the homeopathy and practices the allopathy. Along with this, who think that there is nothing in homeopathy, and while giving the treatment in between he prescribed the homeopathic medicine, along with this he prescribing the quinine, along with this he prescribing the opiate. This is not the thing. If you are a homeopath, you have to depend only on a homeopathic medicine, and for this you must be a study the homeopathy in serious way, in a proper way, and you have to select a proper homeopathic medicine to cure the patient. But if you are not confident in it, that is you are not having the faith in homeopathy, in between you are using the allopathic medicine to give the cure to the patient, this is not the case. If you are a homeopathic, you have to select a proper homeopathic medicine with a proper knowledge of homeopathy, with proper study of homeopathy, and then only you can cure your patient homeopathically. But if you are a homeopath and using the quinine and the opiate, and in between using the homeopathic medicine also, this is not the proper case. And for this, Dr. Kid use the word that is the these are the mongrel sect, that is not having the faith in homeopathy but practicing the homeopathy with mixing of that allopathy. So I would refer an allopath to one who professes to the homeopath but does not know enough homeopathy to practice it. So this is regarding the uh, that explain about the Dr. Kate in this para. So now in next paragraph, Dr. Kent explain as, why should you put crude medicines upon the diphtheritic membrane in addition to giving your remedy? If the crude drugs do anything, they will spoil the appearance of the throat, and you will not be able to know what your remedy has done. If these adjacent to the remedy do anything at all, they will effect such changes as will damage the case. If they do not effect changes, why use them? There can be no reason for administering something that does not effect changes. This question came up one time and created controversy in an association meeting. One doctor recommended the use of the peroxide of hydrogen in pus cavities. He said it does not harm, it does not damage. The question is, does it do anything at all? If it does, if it does, the changes it affects injury the case. Lay it down as a rule that you will use nothing that can effect changes in a case in addition to your remedy. After you prescribe a remedy, you want to know when you come back whether that remedy has done anything. For this reason, you must rest your case upon that which you believe to be the nearest homeopathic remedy. All changes must be watched because by observing changes we know what next to do. If something has been given by patient's friends, changes has occurred. In the case from such meddling, the doctor is in confusion. If absolutely no changes have occurred after his remedy, then he is in intelligence and knows what next to do. So in this para, Dr. Kent want to explain that is when you're giving some remedy and along with that remedy you using some external applications. So if and you say that these external application cannot affect anything. So if this cannot affect anything, so why you are giving that external application, and in that way your remedy is acting or not you cannot understand. So in this he gives different examples regarding this using of a crude medicines or external applications. So in this he gives the first example regarding the diphtheric membrane. If there is an infection of a diphtheric membrane in a throat, your that is crude medicines upon the diphtheric membrane in addition to giving your remedy, that is you are giving some crude form of medicine on that diphtheric membrane along with your remedy. If the crude drug do anything, they will spoil the appearance of the throat. That is, this crude form of medicine which is used by you for that diphtheric membrane, that will spoil your case or the appearance of the throat and will not able to know what your remedy has done, and that changes causes, that is what your remedy is acting or what your remedy shows the effect that cannot be seen with that external application or the crude form of drugs. And if these adjustment of the remedy do anything at all, they will affect the change and that change will damage the case. That is, if that causes some changes in that, that will causes your case. But with that, if they do not effect changes, why use them? And if you are saying that these do not affect the action of the remedy, then why you are giving that remedy or why you are giving that external application to apply on the tissues? So there can be no reason for administrating something that does not effect change. If that does not cause any change, so why you are giving? This question is put forth by Dr. Kent for these type of physicians who are using the crude form of medicines along with their homeopathic remedies. In this he also give the second example, that is patient having an injury and in that you are prescribing the remedy and along with this you are saying to use the using of hydrogen peroxide, so in that pus cavities. So and you are saying that hydrogen peroxide cannot cause any change in that injury. So why you are giving that hydrogen peroxide for that injury in that pus cavities? So this is the question put forth by the Dr. Kent, and ask question, if they do not cause any change, why you are prescribing this, as this will cause any change that will affect your action of a remedy, and you cannot understand what changes or what your remedy is done. So in that cases, Dr. Kate want to explain that never use anything along with your remedy. You have to see the effect of your remedy alone and not use any crude form of medicine or not use of any external form of medicine along with your remedy. Then in next para, Dr. Kent explain about, that is doctors sometimes give opium to suppress pain, but it is more frequently given to suppress the cry of people that stand around listening to the patient. The friends stand there wringing their hands and saying, Doctor, cannot you do something? And the poor doctor loses his head and gives a dose of opium. What What does he do that for? In order to quiet the cry of the people. He knows he is damaging his patient. So starting with next para, Dr. Kent explain about the giving of a medicine in between the treatment. So this is dangerous. So for this he explained different examples. But before that, up till now you understand about what is going in this topic. Yes, are you able to understand? Yes. Okay. So in next para he gives the example of that opium. That is when doctor sometimes gives the opium to suppress the pain. So in that case, uh, when he uses the opium, he uses the opium to suppress the cry of people. What Dr. Kent explained, that is he uses this opium for the suppress of the cry of people, that is not for the suppress of a pain. When there is some pain in a patient, there is a cry of people, that is I am having that complaint and I am having that complaint, but this is to suppress the cry of people. That is what the friends stand here ringing their hands and saying that is doctor, cannot you do something? तुम्ही माझ्यासाठी काही करू शकत नाही आहे का, की मला जो त्रास होतोय, मग जो काही त्रास आहे त्याच्यासाठी आपण ओपीएम देत नाही आहेत, पण जे काही पेशंटचं रडणं आहे त्याच्यासाठी काय करतोय फिजिशियन, त्याला ओपीएम देतोय टू सप्रेस द क्राय ऑफ पीपल. आणि याच्यामध्ये काय, इथेच काय होते, फिजिशियनची मिस्टेक होते की जेव्हा तो काय करतोय की त्याला ओपीएम प्रिस्क्राईब करतोय. तर या कंडिशनमध्ये जेव्हा तो ओपीएम यूज करतो तर त्या कंडिशनमध्ये त्याची डिसीज कंडिशन जी आहे ती तशीच आहे, पण त्याच्यामध्ये आपण काय करतोय की त्याचं जे काही पेशंटचं रडणं आहे किंवा जो काही त्राससाठी जो काही तो पेशंट सांगतोय तर त्याला आपण काय करतोय, सप्रेस करतोय, त्याचं समाधान करतोय. त्याच्यामध्ये द पुअर डॉक्टर लुजेस हिज हेड अँड गिव्ज अ डोस ऑफ ओपीएम. व्हॉट डज ही डू दॅट फॉर, इन ऑर्डर टू क्वाइट द क्राय ऑफ पीपल. याच्यामध्ये डॉक्टरने काय करायला पाहिजे की त्याचं जे काही रडणं आहे, पेशंटचं रडणं शांत करण्यासाठी काय करायला पाहिजे. दॅट इज ही नोज ही इज डॅमेजिंग हिज पेशंट. आणि त्याला माहीत आहे की, ज्याला माहीत आहे की तो ओपीएम देऊन काय करतोय, त्याची केस काय करतोय, डॅमेज करतोय किंवा पेशंटला डॅमेज करतोय. ही नोज ही हॅज पुट आउट ऑफ हिज हँड्स द ॲबिलिटी टू क्युअर दॅट पेशंट होमिओपॅथिकली. आणि ह्याच्यामध्ये तो काय करतोय, जी काय त्याची ॲबिलिटी आहे होमिओपॅथिकली पेशंट ट्रीट करण्याची, तो काय करतोय, लूज करतोय. व्हॉट इफ द पेशंट डज सफर, कॅन दॅट be an excuse for the doctor destroying his power to heal that patient hereafter? The doctor justifies himself by saying, if I had not done this, the people would have criticized me. What business is it of the people? If a doctor has not the grit of withstand the cries of the family, the criticisms of the friends, and the threatening of his pocketbook and his bread and butter, he will not practice homeopathy very long. An honest man does not fear these things. There is but one thing for him to consider, what is right thing he must do. The crazy old woman who stand around wagging their tattling tongues, what has that to do with the life of the patient, or the duty of the patient, or the duty of the physician? Will they shoulder the responsibility of the patient's death if he die? If say now that the death of the patient is nothing in comparison with violation of the law on the part of the doctor. If both instances the doctor gets the worst of it, the doctor who violates the law will violate his conscience, and his death is worse than the death of the patient. Generally, the physician who has knowledge enough and grit enough to wait will see before the patient dies the homeopathic remedy that will control the case. The whole community is sometimes turned into excitement because the doctor will not do this or that. Suppose the whole atmosphere is blue with effect of their wrath, what has that to do with it? The physician who will stick by the patient and let the people how is one that will trusted through every ordeal. So in that para, Dr. Kent want to explain that is, if you are giving some medicine, you will spoil that case, and you know that you are spoiling the case. But what is the business behind that is the physician, is the earning of bread and butter. And for that earning of bread and butter, if he cannot prescribe the opium for that patient and he cannot stop that crying of the people cannot come back to her or him. So in that case, he do that for the earning of the money, or the patients come to him. But actually, what is the ethics behind that? That is, he has not to spoil the case, and he has to cure the patient without giving any hamper to that patient. But in that case, he only suppresses the pain of that patient, but he is damaging his body. And in that if there is a death of a patient, and if you are giving the wrong medicine and you are doing the wrong with the patient, it is more dangerous than the patient death. That is, if you prescribe the medicine and patients die, or if there is some death of the patient, it having that natural death, but along with that, if you are doing the wrong with your patient, it is more dangerous than that death. So in that case, you have to must understand the ethics about the physician or regarding the doctor. That is the what is the duty of a doctor. In that case, if you are only giving the temporary palliation or the suppression to the patient, it is not the case. And for this reason, even if the patient is suffering and you are doing the good for that patient, it is most important. याच्यामध्ये त्यांनी असं एक्सप्लेन केले की जे काही डिसीज कंडिशन आहे त्याच्यामध्ये जर तुम्ही इन बिटवीन जर एखादं मेडिसिन प्रिस्क्राईब करताय की त्याचे जे काही पेन आहे त्याला सप्रेस करण्यासाठी, तर त्याच्या थ्रू काय करताय तुम्ही, पूर्ण केस स्पॉईल करताय आणि त्याचं डिसीज कंडिशन काय होते, आणखी प्रोग्रेस होत जाते. मग हे करणं मोर डेंजरस आहे. पण जेव्हा तुम्ही प्रॅक्टिस करता, ॲज अ बिझनेस करता, तर त्या प्रॅक्टिसमध्ये काय होतं की पेशंट परत तुमच्याकडे येण्यासाठी तुम्ही काय करता, नाईलाजाने त्याला ते मेडिसिन प्रिस्क्राईब करता की पेशंट माझ्याकडे परत यायला पाहिजे त्याने, आणि मी माझे पैसे कमवले पाहिजे त्याच्यासाठी. पण ते करणं चुकीचं आहे, कारण की त्या कंडिशनला जरी पेशंट तुमच्याकडे आला नाही, कारण तुम्ही ओपीएम देऊन त्याची जी काही डिसीज कंडिशन आहे ती आणखी काय करताय, प्रोग्रेस करताय, त्याला आणखी हॅम्पर्ड करताय. आणि हे करणं रॉंग आहे, ते तुमचं इथिक्स नाही आहे. तुमचं इथिक्स काय आहे की पेशंटला क्युअर करणं इन आयडियल वे, फक्त पेशंटला टेम्पररी रिलीफ देऊन त्याचं डिसीज कंडिशन आणखी प्रोग्रेसमध्ये नेणं ही तुमचं इथिक्स नाही आहे किंवा तुमची ड्युटी नाही आहे. यामध्ये पेशंटला थोडा वेळ त्रास जरी होत असेल तर त्या कंडिशनमध्ये तुम्ही दुसरं मेडिसिन प्रिस्क्राईब न करता जी काय रेमेडी प्रिस्क्राईब केलेली त्याच्यावरती डिपेंड राहून त्याला वेट अँड वॉच करून त्याची ॲक्शन बघायला पाहिजे आणि त्याच्यानुसार पेशंटला आयडियल वेमध्ये क्युअर करायला पाहिजे, ना की इतर काही पण मेडिसिन देऊन त्याचं डिसीज कंडिशन फक्त आपल्याला पैसे कमवायचे आहेत म्हणून त्याला रॉंग ट्रीटमेंट देऊन, रॉंग मेथड यूज करून त्याला फक्त सप्रेस करायचं नाही आहे त्याच्या डिसीज कंडिशनला, तर त्याला काय करायचं आहे, पूर्णपणे क्युअर करायचं आहे. तर हे त्याच्यामध्ये त्यांनी थीम सांगितलं या पॅरेग्राफमध्ये. देन इन नेक्स्ट पॅरा Dr. Kent explained, that is in the 63 and 64 paragraph, Hahnemann treats of the primary and the secondary action of medicines. There is no necessity for dwelling upon this subject. The primary and the secondary action of a drug are simply the one action of that drug. Some homeopaths have attempted to individualize between the primary and the secondary action. It does not matter what the patient is suffering from symptoms which appeared in the primary action or from the symptoms which appeared in the secondary action, the drug will cure just the same. Then in next para, Dr. Kent want to explain, that is he give the reference of aphorism number 63 and 64, in which Dr. Hahnemann treats the primary and the secondary action of medicine. That is, he explained about the primary and secondary action of the medicine, and here Dr. Kent explained as there is no necessity for dwelling upon this subject. याच्यामध्ये परत प्रायमरी ॲक्शन कुठली, याच्यामध्ये सेकंडरी ॲक्शन कुठली, किंवा प्रायमरी ॲक्शनने ट्रीट केलं की सेकंडरी ॲक्शनने ट्रीट केलं, ह्याचं परत मोजमाप करण्याची गरज नाही आहे. कारण की जेव्हा तुम्हाला प्रायमरी आणि सेकंडरी ॲक्शन ऑफ ड्रग, दीज आर द सिम्पली द वन ॲक्शन ऑफ द ड्रग. ह्या दोन्ही पण काय आहेत, एकच ॲक्शन आहेत. प्रायमरी ॲक्शन आणि सेकंडरी ॲक्शन, याच्यामध्ये याचे सिम्पटम कुठले, याच्यामध्ये याच्यात डिफरन्स काय, हे फाइंड आउट करण्यात काही अर्थ नाही आहे. कारण की प्रायमरी ॲक्शन हो किंवा सेकंडरी ॲक्शन हो, दोघांमधून काय होतं आहे, पेशंट ट्रीट होतो आहे किंवा तो त्याचं ॲक्शन दाखवतो आहे, हे इम्पॉर्टंट आहे. So it does not matter what the patient is suffering from, the symptoms which appeared in the primary action or from the symptoms which are appeared in the secondary action. that the drug will cure just the same. जे काय ड्रग ॲक्शन करतोय ही काय सेम आहे आणि त्याच्यापासून काय होतंय तर क्युअर होतंय पेशंट, हे इम्पॉर्टंट आहे. सो द सिम्पटम्स दॅट अराइज are the symptoms that arise from the remedy, and they often seem to oppose each other. In the earlier stages we have sometimes sleeplessness, in the last stages sleepiness, and one state is sometimes more prominent than the other. For instance, in opium some provers had sleeplessness first and sleepiness afterwards. From the smaller doses of opium it is known that the opium has both sleeplessness and the sleepiness, and if the other symptoms agree, it does not matter what one of the two is present. मग ते एक्सप्लेन करण्यासाठी त्यांनी ओपियमचं एक्झाम्पल दिले की ओपियम काय करतो, स्लीपलेसनेस पण करतो आणि स्लीपीनेस पण करतो. तर त्याच्यामध्ये opium has both the sleeplessness and the sleepiness, and if other symptoms agree, it does not matter which one of the two is present. If opium is indicated by the general state of the patient, it will cure either of these conditions, and you need not stop to see if it produces one state in place and the opposite state in another. So in some provers opium produces diarrhea in the beginning, in others constipation. If I should take today a crude dose of opium in 6 hours, I would have a diarrhea that would last for several days and then be constipated for 6 weeks. To know that the drugs have two actions is simply knowing the nature of the drug in general. You will find that another example is alcohol. Watch two drunkards and you will see the double action illustrated. So याच्यामध्ये त्यांनी असं एक्सप्लेन केलं की प्रत्येक वेळेस प्रायमरी अँड सेकंडरी ॲक्शन बघत बसण्याची गरज नाही आहे. नेचरमध्ये अशा गोष्टी अवेलेबल आहेत की ज्या आधी प्रायमरी ॲक्शन दाखवतात किंवा सेकंडरी ॲक्शन दाखवतात. याच्यामध्ये त्यांनी एक्झाम्पल परत ओपियमचंच दिलं. ओपियम काय करतो, डायरिया पण प्रोड्यूस करतो आणि कॉन्स्टिपेशन पण प्रोड्यूस करतो. तसंच त्यांनी अल्कोहोलचं पण सांगितले की याच्यामध्ये जर तुम्हाला अल्कोहोलचे ॲक्शन जर बघायचे असेल तर दोन जे ड्रिंक करतात त्याच्यामध्ये तुम्ही त्याचे डबल ॲक्शन्स बघू शकता. सो देअर आर कॉन्स्टिट्युशनल स्टेट इन पेशंट्स बाय व्हर्च्यू ऑफ विच they are always affected in certain ways. These states are often left after proving and are found in those who have been poisoned by a drug. All these patients will have alternating symptoms which will confuse the physician before he knows their constitutional state. If an important thing is to know constitutional state of the patient before prescribing, you will always be able to do better for your patients when you know all their tendencies. Of course, in acute diseases, symptoms sometimes stand out so sharply that an acute remedy can be administered without reference to any constitutional state. Acute cognates can be established in almost any patient. For instance, in calcaria patient will need an acute cognate of calcaria when he is sick with acute symptoms. The acute symptoms fit into are established and found by the constitutional state of the patient. So in this he want to explain that is when you are prescribing the medicine for the acute cases or for the constitutional status. So in that case you must understand about the alternating state of that patient. That is, in some cases they may require the cognate remedy, that is the remedy which are very closely related to one another, that we call it as a cognate remedy. That is, in between for acute cases you may require the cognate remedy, and in this he give the example of that is calcaria. That is, while treating the patient of calcaria constitution, you may require the cognate remedy of calcaria for the acute case which you see in between that treating of a constitutional condition. So this is regarding the oversensitive patient, which is explained by Dr. Kent. So in this way we finish the topic. So in this total topic, the main theme of the topic is that is when you are treating the patient, that is the oversensitive patient. In that oversensitive patient, you cannot give the potentized medicine in repeated doses. If you give the repeated potentized medicine in repeated doses, you will cause the, or you will affect the medicine that patient very seriously, or that will cause the lasting of a disease for many days of that medicine. So in that case, while prescribing the medicine, you will be cautious for the oversensitive patient. As you know that the oversensitive patient can give the poisonous effects in potentized form of medicine, even in a potentized of medicine also. That is not always in a crude form of medicine. You will see the drug poisoning in potentized medicine also. So this is the main theme, and in this Dr. Kent give the references of different aphorisms, that is aphorism number 44, 46, and lastly he give the references of aphorism number 63 and 64. In between he explain about the ethics of a physician, that is not to prescribe the medicine in between the treatment is going on, or along with this he also explained about, that is, use the proper remedy and do not use any external application while treating the uh, patient. So in that way you have to choose the similar medicine and treat the patient according to the guidelines given by Dr. Hahnemann. So this is regarding the chapter number 16, that is the oversensitive patient from Kant's philosophy. So all of you understand or any difficulty regarding it?
No.
Okay, so we will stop here. Please send me attendance.
Oh, ma'am.
Okay, bye everyone. One notice is